So I'm the site director for the Belleville Quinte program. I've been with Queens probably since 2006, teaching the residents. I wasn't as smart as most of you guys are choosing family medicine first. I actually did 2 years of obs gynae before I saw the light, then I switched over to family medicine. My wife was much smarter. She chose to do family medicine right off the hop. I've been in Belleville ever since I graduated in 2004 from Manitoba. I do a comprehensive practice. I do inpatient care at the hospital. I do emerge. I do my own office. I do nursing homes. I take care of our local OHL team, the Bulls. I do leadership stuff in the hospital. Most of our group is relatively weird that way. We do almost everything that there is. We get bored very easily. Okay. So this is a nice aerial view of Belleville. As you can see, we're located on the Moira River, right on the shores of the Bay of Quinte, which is a protected bay on the lake on Lake Ontario. Now, where are we? So we're just down the road from Kingston, around 45 minutes to an hour, depending on how fast you can drive on the 401. And as you can see, it's a beautifully protected bay, great for skiing, nice tries. Water skiing, sailing, power boating, things like that. So it's great for novices because that way you're protected from the much rougher Lake Ontario. Okay. This is actually, my wife calls this my third child. We have 2 little girls, and this is my third baby. This is our Belleville Queen's University Family Medicine Center. I helped build this building, so I spend almost as much time doing this as I do with my children at times, my wife says. This is actually the main center of the Queen's program in Belleville, and I'll talk more about it later. Okay. This is our group of second-year residents. You'll get to meet probably 1 or 2 of them today. Our other 2 are actually off on maternity leave. They're really practicing family medicine. They're practicing their care of children skills and things like that. It's actually pretty cool. Both of them were best friends at U of T. They became pregnant, delivered within 2 weeks of each other. They're already planning the marriages of their children. One has a boy, one has a girl. So now a little bit of the dry stuff about our program. We are a fully accredited 2-year integrated horizontal curriculum, and we are very horizontal and integrated. We follow all the triple C ad nauseum. You'll be exposed to comprehensive care, continuity of care, not only your family medicine clinics, but even when you're out at the specialist clinic, and family medicine as central. We try to make your identity as a family doc from day one. You're not an off-service resident, you're a Belleville Quinte family medicine resident first and foremost. That's how we identify with you, and that's how the specialists in town identify with you. So as I said, we're a truly integrated curriculum. Your identity as a family physician is central. We're very family friendly for work and play. We're a young group, lots of young kids. I think our oldest kid is my daughter. She's 5. We have as young as, if you include our residents, 2 to 3-year-olds in our group. There's around 10 to 15 kids amongst a small group of us there. We're kind of unique. We have a lot of physician couples. I'm one of the physician couples, but we have a total of 4 physician couples. So it gives a rather unique perspective. It's one thing to practice on your own within a group, but when you practice with your spouse, it's a whole new context to practicing medicine. And it serves, especially for female learners, serves as possibly good role models. You can see how you can sort of balance and juggle it. Male physicians don't have nearly the same conflict demands it seems that the female physicians do. I don't know how my wife does it, because she just seems to be superwoman there. She's always there for the girls, but she's an amazing family physician, and she does everything just like I do also. So it just serves as a role model. What do you do when you actually have a sick child? How do you incorporate that into your practice and things like that, and make sure that everyone feels that they're number one. Our residents and faculty do have very special bonds, not only just amongst us family medicine preceptors, but also along the specialist line. The best example we had was last year. One of our residents was doing an elective in ICU with one of our cardiologists. She wasn't doing call, anything like that, but she just lived up the road from the hospital, had a really good relationship with the cardiologist. He was on call for internal, had a guy come in with cardiac tamponade. He had an internal medicine resident on with him from family medicine from the Kingston program. He also had an internal medicine resident from the actual internal medicine program from Queens there with him, along with another resident in ICU. Who's the one he called? He called our resident, called her at home to come down and do the pericardiocentesis. He forgot about all the other residents, but he thought that'd be the greatest learning opportunity for her. So, as a Belleville resident in the area, you're first and foremost on our specialist minds, along with us family physicians. Okay. As I said, we are an odd bunch of family docs. We all do clinic. All of us have hospital privileges. All of us do inpatient care. Our inpatient care includes acute medical. We do all the palliative care for Belleville General. We do the rehab, complex continuing care along with acute medicine, and we also do the majority of the newborn care in the hospital. Over 90% of us do emergency room work. All of us are Queens faculty. In addition, a lot of us have special interests. Some of us do retirement homes, some of us do nursing homes. A lot of us are in leadership roles, not only locally but also provincially. Some of us do sports medicine. That'd be mainly me. I cover the Bulls. One of my colleagues actually did the leads course for dermatology, so she's a certified GP dermatologist, and one of my other colleagues also did extra training in palliative care. Our group as a whole does a lot of the palliative care in the hospital. She also provides us some of the community support for our patients. In addition, most of us do take care of our palliative care patients in the community. Okay, so we're going to talk about some of the core experiences that you guys are going to experience when you're in Belleville. So these are your core family medicine clinics. It isn't necessarily strictly clinics all the time, but this is your cohort of patients that you're going to be following. So you're not only going to see them in clinic, this might incorporate you're going out to home visits, maybe you're seeing them in the retirement home, maybe you're seeing them in the nursing home. On average, around 2 days a week, you're going to be in clinic with your one preceptor. All of us work in a very team-based approach. Most of us are in pods of 2 to 3 physicians. So you're not only going to see one doc, you're going to have interactions with 1 or 2 other docs at all times. In addition to all our staff, most of us have RPNs and RNs along with our admin staff. Family medicine is very central. Continuity, we try to focus on that greatly in order to get patients to come back and see you. We have 3 locations that we use. Belleville Queens University Family Medicine Center is our largest site. Connor House Family Practice is just 2 blocks down the road, and East Hill Medicine is just down from the hospital, all of them within walking distance of Belleville. Okay. We have a comprehensive family medicine led hospital system within Belleville General, led mainly by our group of physicians. There's a group of 15 of us that do most of the teaching. We'll do almost all the family medicine teaching in Belleville, and we're the core part of the family medicine department at the hospital. Residents do on average around 5 weeks of this per year. It's usually with your primary preceptor. The only exception would be if it just doesn't work in the scheduling. Maybe they're away on conference, vacation, and you have other things going on, but around 9% of the time you'll be with your own primary preceptor. This is located at Belleville General Hospital. This is a rather intense week. You're going to be doing acute medical patients, so you're going to be taking care of strokes, pneumonias, urosepsis. In addition, you're going to be doing all the palliative care. The internists hate doing palliative care because they don't know what they're doing. Hence, they always consult us to take care of the palliative care. Even in ICU, the intensivists come and get us to do the palliative care. We're involved in rehab. We have a brand new wing of our hospital dedicated to rehab medicine. So you'll take care of an acute stroke, you'll transfer them over to the rehab, and you'll continue on with everything from there. Along with, we do a lot of joints, post-op knees and things like that you'll be taken care of. We also do a lot of newborn care for the hospital. Anywhere from 2 to 5 newborns a day you'll get a chance to see. Those are normal, healthy newborns. If there's anything complicated, pediatrics becomes right involved. Unless your primary preceptor has a higher skill set, they'll do it. If you're with me, I panic rather easily when it comes to newborns. I'll consult pediatricians. If you're with my lovely wife, she'll actually take them to the special care nursery and take care for them there and not get pediatrics involved. Family medicine on call is home call. You're usually on with one of us primary preceptors. It may not be your own, but it'll be one of the core group of us. You're going to be admitting patients that come in that are appropriate for family medicine, so urosepsis, pneumonias. We'll take care of some acute coronary syndromes, all depending on how aggressive they need to be, because we do have internists and cardiologists on site. You also will cover any urgent issues that come up. Most of our urgent issues don't come up on the acute medical floor. It's usually over in a rehab hospital. I think probably the sickest one we ever had was around 2 o'clock in the morning. We got paged about some rectal bleeding. We're like, well, how much bleeding she had? Well, I don't know, maybe a cup. We came, this lady was gushing, gushing blood. We actually had to call the intensivists up. We put in a central line. We couldn't even transfer her to a medical ward. We transferred her right to Kingston ICU because she needed a interventional radiologist, because the general surgeon said, I operate on her, I'm going to kill her. You need interventional to stop the bleeding. So it's amazing where you get your acute medicine. It's not usually on the acute medical floors after hours. In second year, all you guys go outside of rural Belleville to somewhere else. From a Kingston perspective, Belleville is considered rural. From Belleville's perspective, we do send you guys out just to get a different flavor, maybe go even smaller within our Quinte Healthcare family. We use Bancroft, which is a little outpost hospital around an hour north of Belleville, has 6 inpatient beds. It's run by family docs. They have point of care testing. They have limited access to imaging after hours, so you're really using your clinical judgment when you're there, and you're really in the middle of nowhere. So it's a great learning experience. If there's someone, if they need, they have to be sent out, but you have to do the initial management. We also have Trenton, which is a primary care hospital, just 15 minutes down the road, which is very commutable. Picton is another primary care hospital, very well run by a strong group of family physicians there that have been teaching Queen's residents for over 30 years. Those are the main sites we use, but in addition, any of the Queen's approved rural sites, you can go to. One of my residents, she's actually here today. You'll see her during interview. She's going to Moose Factory in 2 months. So lots of opportunities. Emergency rooms, we use two different emergency rooms, Belleville General Hospital and Trenton Memorial Hospital. Just a little bit of a different flavor. Belleville's much more of a secondary care hospital. You have access to all the specialists, all the services, things like that. Trenton, there's no specialist backup on site. Belleville serves as a referral site. Similar acuity, we're all in 401, we get all the trauma coming in. Both sites see anywhere from 30 to 35,000 visits a year. Sometimes you'll be paired up with your primary preceptor. Most of the emerge are run by, these are guys that have done nothing but emerge their entire lives, or they've done the CCF-EM program. You get to spend time doing internal medicine ward experiences, some time in clinic doing cardiology, GI, stroke, just to round out your knowledge. Pediatric clinics are well received. We have 4 very dedicated pediatricians in the community. For obstetrics, we do it a little bit differently. We don't send you there for a block. We do more what we call clusters, i.e. you'll sort of spend a 7-day stretch where you'll do the 24-hour in-house call, do deliveries, and in between you'll probably come back to your clinic a little bit, but the main thrust for that week will be obs-gyne on call to try to consolidate your skills. Then a few months later, you'll repeat that cycle. It allows you the opportunity for your prenatal patients that you're following, the ability to maybe deliver them while you're on call. Okay. We also do orthogen surge on call, where you cover both services. This is very learner driven. The specialists aren't used to having any residents on call with them on the weekends, so they're more than happy to let you choose what you want to do. The reason why we do it combined is since it's a community hospital, sometimes ortho is way better than general surgery, so we hate to have you on call for general surgery sitting around twiddling your thumbs while ortho is incredibly busy with great learning opportunities. The whole thrust of it is if emerge console gen surge for abdominal pain turned out to be an appendicitis, if you wanted to, you can go assist and see that case through. If you see a dislocated hip come in, you want to go with the orthopod for that, you're more than welcome to do that. The surgeons don't expect anything of the service. They're just there to help you out and help you learn. So it's a rather unique experience, much different than most surgical experiences you'll get in the tertiary care site. Minor procedure clinics, this is done almost many different venues. We have a dedicated minor procedure room within our clinic that we'll use more for the more difficult ones, i.e. positioning's a little bit more difficult. Most of us do minor procedures right in our office. You also can spend some time with the general surgeons at the hospital doing minor procedures. Behavioral medicine is a big part of family medicine. We do a lot of that in clinic. We also have a psychiatrist that comes around once a month to provide us some support. We usually get her to see one of our own patients in consultation, and she usually interviews the patient with one of the residents where everyone else watches. She usually does it in a group setting, so it helps residents with their interviewing skills from a psychiatric point. In addition, you get to learn, because lots of times it's one of your own patients that's being interviewed, and she also provides psychiatric help from there, what recommendations to follow and go forward from there. Every Wednesday afternoon is protected teaching time, mainly focusing on covering the 99 core topics. Majority of this is taught by family medicine preceptors in town, very little video conferencing for that. We have some specialists that do come teach in topics that they're strong on. Also, Kingston, we also get some of the more world-renowned Kingston faculty like Dr. Ruth Wilson, who was former Wonka physician of the year. She'll come down and give guest lectures and things like that to maintain that connection, okay? You do have some teaching in Kingston, the nightmare simulation course. This is simulating all your worst nightmares on call, actually having a sim lab to run through the different scenarios. This year was a pilot year. Next year we're going to do 4 sessions per year for both PGY1s and PGY2s, matching your skill level, trying to push your comfort level so you're much more prepared for those emergencies. Problem with medicine, as we get better, you get less and less of those occurring, hence you don't get nearly the volume, so this is a good way to do it. Research days you come here for, NRP and alarm, so usually in Kingston, anywhere from 3 to 5 times a year. Most of the research stuff we do by video conferencing. Now this is a sample schedule. It looks really busy, okay? It looks really, really confusing. You have to talk to our residents about it. It's actually very intuitive and very easy to follow. So let's say on that Monday, you're actually in your family medicine clinic and you went to a home visit, maybe you were seeing patients in the clinic. You did 2 days of that. Then you actually went to stroke clinic. For all you know, you actually saw one of your patients you recently admitted and discharged from hospital in stroke clinic in follow-up. You'll spend some time with one of our emerge docs. Dr. Bell is actually a Queen's grad with his EM. He's incredibly beyond. He attracts all the nightmare stuff that comes in. They have more ambulances come in when he's there. The nurses hate it. The residents love it because you get to see a lot of cool stuff with them. And then you'll see maybe on that Friday you're actually doing a nightmares simulation. The following week, you're doing mainly your family medicine clinic, a little bit of time with our gastroenterologist. Then you start doing a week of hospice with your primary preceptor. Always that teaching is protected Wednesday afternoon. And then each Friday after you do hospice, we don't want you guys to work. We call them research academic days. This is your recovery day to go off and live your own life. If you want to work on your research project, you want. If there's stuff that you want to read about, that's your time to do it, or just to get the errands of everyday life done, dentist appointments, going to see your own doctor. This is your time to do it. There's no clinical activity associated with our research academic days. Then you can see the next week, you're back in clinic with your primary preceptor, Jonathan. Then you're in your pediatrics clinic the following day. Then you get to do some obs-gynae clinic for a half day. And let's say you decide to take a professional day, maybe you saw a conference you wanted to go to, then maybe there's a wound conference in Belleville you wanted to go to. Then you end off your clinic on a nice slow Friday in the office. Now in second block, there's bound to be a stat holiday somewhere. So you get the Monday off. A little bit more clinic. You're actually on call with me that night. I try not to torture the residents too much when they're on call with me. Just don't call me. I'm just kidding. Then you're back in emerge with Dr. Bell. There's another research academic day in there. Then this is a sample of the second week of a little bit of an obs-gynae cluster. So you're doing your 24 hours in-house, realizing your first 8 hours during the day, most babies aren't delivered because they like coming when it's really inconvenient, i.e. the middle of the night. So you're going to be busy there. You get your post-call day, then you actually go in with one of our obstetricians on the Wednesday, seeing some prenatals, maybe doing some endometrial biopsies in his office. You're doing teaching. Then Thursday, you're back on the labor floor again delivering. The Saturday, you're doing the same thing to help consolidate your skills. Next week, you're back into a little bit more of a nice lifestyle again, doing office. You're with Dr. Barnaby, who's downstairs in the clinic, one of our general surgeons, seeing consultations, maybe even one of the patients you referred to, maybe for a screening colonoscopy for abdominal pain that we couldn't figure out. And then the week, you're actually spending time with our cardiologist that knows everything in medicine. It's rather annoying. Any question you have about internal medicine, he usually knows the answer for, no matter how vague. And then you decide you want to take a week vacation. So that's sort of a representative sample schedule for you guys. Everyone's schedule is very individualized. Our program assistant Christine is amazing at getting this all scheduled and coordinated, because you guys don't have to schedule any of this except your vacations. Now, where will you actually work? We've already seen the picture of the clinic, so this is the home of the program. All the administrative support there, my office there, our program assistance rooms there. We have 21 state-of-the-art exam rooms. I like my play toys, I like my technology. It's a totally paperless office we use. We have an EMR, our conference room is an 85-inch plasma TV that has full video conferencing capabilities. The residence room is there, our minor procedure room I'll show you, and there's 11 us family docs there, and 2 of the general surgeons are there. This is our minor procedure room. Before we reconfigured it, the bed can do almost every position manageable. Good thing they have a master button, so it goes back to a preset position, because we can never figure out how to do it before. Picture of one of our standard exam rooms. I'm pretty OCD about things. I want all the rooms the same, so that way I don't get confused when I'm in the exam rooms. Everything you need is in those exam rooms. My part of the office, I'll use iMacs, we don't use PCs. All my other colleagues use PCs. Mine don't. My computers don't crash nearly as often as theirs do. I'm a little bit biased, man. This is a conference room with a nice 85-inch plasma TV. Really good to watch hockey and the World Cup on that, along with the Super Bowl is not a bad idea also. Okay. This is the residence room. This is an older picture. The residents have really decorated up, put a lot of pictures up. They don't let me in there anymore. This is one of our other sites. This is Connor House. This is actually the home of the first female family physician in Belleville. 3 of my colleagues practice there. They're connected wirelessly with us to our EMR, so we're actually a virtual clinic. Much different feel, it's a much older building, much different feel to it. She has white leather couches in her waiting room. It's almost more of a spa-like atmosphere. None of the patients sit on the white couches, because I always ask her, do they get dirty? Like, no one ever sits on them. They sit on the nice little small seat right at the end, or they stand. Even though she tells them you can sit down. So it's a very distinct environment to work in. Very reflective of the personalities that work there. This is Belleville General Hospital. We have a few wings. This is our Quinte wing. Right next to it, behind the trees, is our brand new rehab wing. This is the referral center for all of Quinte Health Care. So Bancroft, Trenton, Picton referred to Belleville. We have 250 beds. We have full service lab. We have all the imaging. We have everything except the PET scan on site. We have tons of radiologists to read the CTs, MRIs, and we do have interventional radiology on site. There's around 18 of us family docs. We have cardiologists, gastroenterologists, a bunch of general internists. We have 5 very hardworking orthopedic surgeons, 6 talented general surgeons, lots of obstetricians, gynecologists. We actually have a closed, brand new 15-bed ICU that's run by 5 intensivists for us. We also do TPA for strokes. That's a new service that we've added. We have 3 urologists, which is incredible, along with 2 ENT. In our emerge, we can't keep track of the number because we have so many emerge docs that do come in work at our site. But we do almost, for a secondary care hospital, we do almost every, we have very good services. Now, really the reason is, why do we like to live in Belleville? You can probably go work at anywhere and find similar things, but this is why we love to live in Belleville. We're just down the road from Sandbanks Provincial Park, so any of you guys like beaches, this is a beautiful beach. It's one of the largest natural sand dunes in the world. Miles and miles of pristine sand. This is actually one of our residents off on mat leave. This is before she got pregnant. She loves going to the beach. This is our second year at one of our Christmas parties. We do try to entertain quite a bit and socialize. And no, we do not drink at any of the parties. We just sip our Perrier, and that's about it. But no, the residents usually have a really good time, and they're a really tight bunch. Okay. You can also do skating. This is one of our faculty, Jonathan Kern, his lovely little daughter, learning how to skate with his lovely wife at the Yardman Arena. This is our current batch of first years. Don't you notice how happy they are? Very happy group of residents. That might have been before they had met me, but then we also do road trips from time to time. This is a bus trip up to Ottawa to see a Sens Habs Habs game, remember the right answer is always Montreal, because I'm a huge Habs fan. If you talk to my wife, it's Senators. We do have Leaf fans in the audience, but there's counseling for the Leaf fans. Lots of fishing on the Bay of Quinte, walleye tournaments, bass fishing, whereas little Gwen, she doesn't care, she just wants to use her fishing rod, she doesn't care if she catches anything with her little brother, okay? Or you can do car racing with my little girls. They figured out how to put that car in high gear pretty darn quick. You can actually go down the road to Shannonville. They actually do have a raceway for those of you that are interested, or you can top out around 8 kilometers an hour in the Cadillac. Now, lots of opportunities for boating in Belleville. The only catch is you either have to choose powerboat or sailboat. You can't say you like both. I learned that the hard way. I'm like, yeah, maybe I'll sail, maybe I'll powerboat. No, you have to choose. I'm like, okay. I'm actually a big powerboater. Sailing just seems like a heck of a lot of work. When I'm on the water, I want to relax, not work. So listen to my little girl, my father-in-law's boat. They love being out on the water. And did I mention the beach? We do like the beaches. This is another picture of sandbanks. Okay. We also have hockey and the Belleville Bulls. Yeah, they're not the Peterborough Petes, but we think they're way better than the Peterborough Petes. Like most small towns in southeastern Ontario, Ontario Hockey League is usually a big part of the culture within the community. The Bulls are a big part of our community. You might recognize a few of these guys. Sean Mathias plays for the Florida Panthers. Right next to him is a loudmouth from Montreal that we like to call PK Subban. Every year, Belleville holds adult camps for us men that want to go play hockey and play with some of these guys. Usually play with some of the rookie Bulls, but some of the former pros do come back and teach us. So it's a really cool environment to live in. And Belleville's a huge hockey town. Any of you guys that want to play hockey, our Belleville Docs, we send 2 teams to the OMA tournament every year, and we're always recruiting. Our former program director said that's how I screened. I don't screen based on hockey ability. Having one of the top goalies in the Docs on Ice tournament was just a coincidence that she was a resident. It wasn't the reason she was admitted to the program. Yeah, she is our girl goalie, and she's very, very good. And we do have a second guy goalie too. That, again, wasn't a factor in getting a position in the program. There's also big horseback riding. This is Becky, one of our residents, and another one of our faculty that also does show riding. Very big horse community in the area. Okay. Golfing. This is the reason why they recruited me into Belleville. All they said is 18 golf courses within 20 minutes. One that was ranked number 4 in Canada the year it opened is actually going to hold one of the pro tournaments in 2015. So lots of golf for any of you guys that want to golf. And I said I want. Soccer or skiing, Batawa Ski Hill. It's by far not the Rockies, but it's just down the road. It's good for your family skiing and just get your fix. It's like a 10-minute drive from Belleville. Soccer fields, we have lots. There's a huge contingent of soccer fans in the area. Or you can do what I like to do every weekend. I just relax by the pool and have a bunch of people over just to just relax and have fun with the kids. Just hope to see you guys in Belleville, and we'll take questions at the end.